So next presenter is Dr. Jeff Ellerhorst. And we've invited Dr. Ellerhorst to join us today to cover how to recognize the symptom and how to get treatment for COVID-19. And we'll do a little bit of Q&A and then open up for questions. Dr. Ellerhorst?
Hi, how are you?
Great, thank you.
Thank you for having me. So my name is Dr. Jeff Ellerhorst. I'm a family medicine physician coming to you from Northeastern Ohio. As far as my participation with coronavirus at this point, I have worked at flu clinics that my hospital has set up that are basically triaging points for patients who have symptoms or are concerned about their own having coronavirus. I'm also on my hospital's infectious disease committee as well. So it's been a very busy time for us. So can we move to the next slide, please? So the first question is, how does coronavirus actually spread? And the real important piece here is that, as was just discussed, there's no real treatment that we have at this point for coronavirus. So the old saying goes that an ounce of prevention is worth a pound of cure. That's really where we're at, especially with social distancing. Okay, so as far as we know right now, person to person is the most common spread of the disease process, especially through respiratory droplets. In other words, when you cough or when you sneeze, the particulate that gets into the air. From what we know and what the CDC knows is that from what they looked at in the past for SARS and MERS, is that it typically hangs in the air for about a period of 3 hours. So that's what we know there. Almost all of the known coronavirus cases also come from person-to-person transmission. And again, that's why it is so important that we keep social distance at this point in time. Everybody should know as well that when you cough, when you sneeze, it goes into your arm, okay? And that's at any point in time. Also, hand washing is extremely important after you cough or sneeze. 20 seconds is recommended. Use soap, and a lot of the important parts of washing your hands is actually the friction that you have while you're washing. So it's not just pat a little bit of water and soap on your hand. It's actually wringing out your thumb, washing the palms, wringing out your fingers, and getting underneath your fingernails for a total of 20 seconds. Good luck getting my 7-year-old to do that, but as you know, it's very important to do. Also, if you use a hand sanitizer, you're looking for something with 60% ethanol and 70% isopropyl alcohol. With regard to the masks, I think the CDC will be coming out with something within the next day or two about when to wear those masks, okay? The other issue, in this one has a lot of questions about it, is the contact with contaminated surfaces. We know that the coronavirus can live on different surfaces for several days at a time. And a lot of this information, again, comes from what we know about SARS and MERS. So it can last on plastics and stainless steels for a couple days at a time, on cardboard for about a day, and on copper, I think, for about 4 hours, although that's really highly unlikely. So what we need to know about the contact with these contaminated surfaces is actually, how to clean it. So a good resource for this is actually on the EPA's website. They have a full list of cleaning materials that you can use for whether you're talking about a porous or a non-porous surface. Really easy at home. A 1/3 cup of bleach per gallon of water, or 4 teaspoons per quart of bleach per quart of water, has really been found to do an excellent job of killing the coronavirus. And also, just again, as we discussed with washing hands, just the physical act of cleaning can kill the virus in and of itself. I will also say that as far as the contact with contaminated surfaces go, the CDC says that we actually haven't had any transmissions from a contaminated surface. So we'll continue to follow the data and trends on that. Okay, next slide, please. All right, so identifying symptoms, this is an important part. One of the issues with coronavirus is that it's almost a great imitator because there are so many things that look and act just like the coronavirus. Again, the symptoms can appear from 2 to 14 days of exposure based on what we know. You get the fever, cough, and shortness of breath. Fevers, typically we call a fever 100.4 degrees, so 100.4 degrees, although if you go, for my example, my hospital is checking our temperature but before we even start our day, and if you're over 99.5, they will send you home immediately. So it's something that you may actually want to trend on yourself and your loved ones. As far as the cough goes, the cough is typically non-productive, so you're not spitting up a lot of green phlegm. It's more, if you spit anything up, it's likely to be clearish to whitish, which is more what we would expect from it could be a viral illness. Now, if you are actually diagnosed with coronavirus and you have just that dry hacking cough and it does turn into dark green globs, I'm sorry, this is probably near lunch, but I would be concerned more for a bacterial pneumonia. Of course, coronavirus is a virus, and pneumonia typically caused by bacterium. So the emergency warning signs, this is very important as well, because many people will get this virus and they'll have very mild cases, just as the previous slides had identified. It's the trouble breathing. It's the shortness of breath, where you just cannot catch your breath. You feel tightness, a tight band around your chest. That's a concern. Persistent pain and chest pressure is an issue, and sometimes people will also have abdominal discomfort, and that's more along the lines of if you have a pneumonia that's rubbing up against your diaphragm, that is right underneath your rib cage, that can actually cause pain down in your abdomen. Confusion, inability to arouse, and the bluish lips and face. Now, I actually really like the buddy system that you guys have set up where you check on people every 6 hours. I think that's wonderful. I think that, you know, if you're having confusion or difficulty breathing, people have a tendency to panic. And so keeping an eye on these people is an excellent idea. The question here is, you know, do you transport the patient to the hospital yourself? Do you call 911? If you see these issues, you know, I highly recommend calling 911 and getting an ambulance. That way, God forbid, in the case that you need a rapid sequence intubation, you know, where they put the tube down your throat and help you with breathing and move oxygen actually into your lungs, I think likely you're going to need something like that. Plus, you know, you can't really blow through red lights, you know, to get to the hospital if you're having these kind of symptoms. Now let's move to the next slide, please. All right, again, like I was saying, the coronavirus is a great imitator because you have the cough, the fever, the shortness of breath that you can get with any of these other disease processes. And it's flu, allergies, common cold. I mean, there are other disease processes. It also looks like even anxiety and strep throat, even mononucleosis. And we're seeing some of these things at the flu clinics we're working at when we do rapid strep, we do rapid flus and monospots. But the primary symptoms are the dry cough, fever, shortness of breath, and fatigue. It's interesting, the less frequent syndromes, the first one up there is diarrhea. The American Journal of Gastroenterology recently put out a paper that said about 50% of mild to moderate cases of coronavirus will have diarrhea as their first symptom, and that's with or without a fever at the time. So look for loose, watery stools as a possibility of having that. And of course, that opens the coronavirus into looking like even more diseases, unfortunately. But keep in mind that that's what it potentially could be. And I believe that research came out of, it's coming from hospitals in China as well. So just an FYI on that. Seasonal flu, we know it is still flu season. In Ohio, where I'm at, there are between 300 to 500 cases of flu noted still per week that are positive. What I see in the primary care clinic with the flu is a really high fever, 103.9, terrible headache, and terrible severe body aches. So that's when I think flu. Common cold, everybody's had one, sneezing, stuffy nose. You're not going to be as horribly uncomfortable. And I think this is what a lot of people are hoping, that if they get coronavirus, I feel like this is what people are just, especially my age and younger, are hoping they just get some sort of gentle, like common cold like symptoms. And then of course there's seasonal allergies. It's kind of really an awkward time to have seasonal allergies. Like me, the trees are starting to have leaves and the flowers are sprouting, and so I'm sneezing. So it's not a really great time for that, but that's where we're at. And again, as far as anxiety goes, in the flu clinics, I've seen very anxious people, who they will get a little bluish around the lips and cold fingers. They may have a little bit of a cough, especially if they have like an anxiety related cough. It can happen. So keep in mind, this is actually a pretty great slide to look back on. The reality though is, if you have these symptoms and you are concerned, you need to get a hold of your primary care physician, primary care team, just to see what they would like you to do. Let's move to the next slide. And as far as treatment goes, again, there's no current treatment. There are, as was previously already discussed, several medications under that are being investigated, under investigation, including the hydroxychloroquine and the other medications. I know azithromycin is one that's a potential out there. So the reality for what you need to do for yourself is to make sure that you are practicing your own supportive care. And that means even leading up to this, because if there's a 14-day incubation period and you're not doing a nice job of staying hydrated, keeping good mental health, resting, then you can really get caught off guard by some of these symptoms. So make sure you're drinking plenty of fluid, you have good social support, you're resting up good, okay? Over-the-counter medications, Tylenol is really good. I know there's been some conflicting data about whether or not to use ibuprofen. Personally, for me, I'm trying to stay away from using that, especially with my children. It's not necessarily what the CDC is saying, though, at this point in time. Okay. Again, seek care from your medical professional over the phone. If you have the minimal to moderate symptoms, they're likely going to tell you just to wait it out, tell you to eat healthy, drink plenty of fluids, okay? And again, if you have severe symptoms, please go to the emergency department, go to the hospital, do what you need to do there, okay? And I believe that that is my last slide. The last thing I will say though with the treatment though is that Kaiser actually put out a really good little article that's showing that about 45% of patients are having a lot of anxiety issues to go along with this. So please take care of your mental health along with this, okay? All right, so question and answers.
Yes, great advice, and thank you for this overview. We have, just want to remind all attendees that the chat is open. We encourage you to fill in any questions for Nick or for Dr. Ellerhorst. I've got a couple that I'd like to start with Dr. Ellerhorst.
Okay.
A lot of concerns over the process when you go to the hospital, especially a child, but it could be a loved one that has to go to the hospital. What are hospital allowing? Can a parent go with their child, or can an adult go with their loved ones if they need to be hospitalized?
So my first recommendation there is to call your hospital ahead of time to figure that out. I have looked at my regional pediatric hospital, which is Akron Children's Hospital, and they're allowing one guardian in at a time to stay with the child themselves. So yes, you should be able to have a guardian. As far as my hospital that I admit patients to, they're making patients' family members sit out in their cars while they wait. So again, it may be good to call ahead, figure out what's going on for that. But almost, I can't imagine a circumstance at a hospital at a pediatric hospital where a parent isn't going to be able to go in to be with their child. Does that answer your question?
Yeah, thank you. Another one is around mask. And the question is, can we make our own mask? And if so, what's the best material?
Okay, so my wife thinks that this nice blue material is probably the best. This is one she made for me. The reality is that these masks that are made at home are better for keeping large droplets from passing from one person to the next. I think they're a very nice idea. They're very nice for the community, but they're not necessarily going to help the spread as much. Again, I think we're going to get more guidelines in the future. There's the surgical mask that, we've seen these everywhere, whether it's on actually a surgeon to the hospital or on a meme going around, that you see these will filter a little bit better, but not perfect. That when you put them on over your face, there's still room for air to flow in and out from the sides of the mask. When you wear them, make sure that it is covering your nose. I see, a lot of this kind of thing going on, but these may be mandated coming up soon. Up next is actually, I have all the masks, the N95 respirator. We actually get fit tested at hospitals for these, where they'll put almost a clear bag over your head and spray very fine particulate in. And if you can smell or taste it, it's really acrid at all, then it doesn't fit correctly. So you actually need to have one of these if you're in the health field. So that's what an N95 looks like.
Great. Good question that's come up on the topic of masks. Why is Trump, Pence, and 6 others standing shoulder to shoulder at press conferences with no masks?
That's a great question. I honestly can't answer that. I get the feeling that they have been tested many, many times over. Okay, so maybe optics there aren't perfect. So I can't answer that for you.
All right, one last one. We get a lot of questions around food delivery.
Yeah, of course.
Is that really safe? Is it really safe to order out in a pandemic?
At this point, per CDC guidelines, it is. The CDC has not found that coronavirus can be transmitted on food or even so much the packaging surface itself. So as far as what they're saying, yes, it is. I know we've ordered out several times during it. I know I may not be the best for that, but yeah, it should be perfectly safe.
Hey, Jeff, so quick question. So I don't meant to be answering questions, and I just got curious. I want to ask a question too. Can you talk through a bit how, what procedures we should take, if any, when we receive packages from Amazon or wherever, as well food, like, you think we should have a holding dock and let it just sit for a while? I'd love to get your thoughts on, or do we just not care and just put our hands in it and whatever?
Like I said, the coronavirus can live on cardboard for 24 hours. So, if it's a pair of shoes that you ordered and you're really very concerned about it, go ahead and just let it lie in place as long as it's in a safe area, if that's how you feel. If you have gloves that you can wear, that you want to, take whatever you need out of the package, you can remove the gloves as well. It's a very, very low likelihood. Like I said previously, the CDC has not reported any cases of coronavirus being transmitted from a surface to a patient. I think you should be fine.
The funny question, but how would the CDC know that? How's that measurable?
I don't know how it's measurable. Honestly, I think that's coming off of what they've seen from SARS and MERS in the past.
Oh, got it.
And I think the way that the coronavirus is actually, the way that it actually is, it's not a very strong virus itself. So it's easy to kill, actually.
Well, Jeffrey, thank you so much. Really, really appreciate your time, and it's super helpful. So thank you for that.
No problem. I thank you for your time, and thank you for having me.